And turning back to local news, nearly a third more scholarships for budding healthcare professionals to pursue their careers were given out this year. The 161 went to over a dozen disciplines such as allied health and nursing. From all this, two scholarship recipients join us in the studio. We have with us Ms. Nur Syazana Gonzaga, recipient of the Healthcare Merit Award for Social Work, and Mr. Sebastian Jedidiah Jivon, recipient of the Healthcare Merit Award for Pharmacy. As a question to both of you, can you narrow down what sparked your interest and passion in your respective fields? Was it something or someone?
I guess for me, it all started in 2015 when my mother was diagnosed with breast cancer, and I was given the opportunity to to accompany her to her chemotherapy sessions and certain family day sessions that the hospital had planned for the breast cancer patients and breast cancer survivors. And during those family day sessions was when I realized that these medical social workers were the ones planning these events. And I felt very inspired that there are people in the healthcare sector that are there to support patients emotionally and the families too in journeying through their very dark period in their lives in terms of a healthcare crisis.
Jedidiah, let's bring you in on the conversation here. You started volunteering at a very young age as well, we understand, at around the age of 9. Tell us about your experiences and what made you return to Singapore. You were overseas.
Yes.
And you decided to return to Singapore to further your studies here. Tell us something about those experiences you had.
So for me, actually, I am Singaporean. So we moved to Nepal when I was 5 years old. And there my parents were involved in a lot of community projects. One of it being actually bringing medical camps to rural villages in Nepal. And I think it's at these camps where I really saw the need that could happen if healthcare doesn't reach out to certain people groups. So I think one of the biggest impact for me was there was this elderly who had decayed teeth who came in, and at that time I was helping out as a dental assistant. So as I held a torchlight and hold a tray of dental instruments for the dentist to extract the teeth, the teeth actually broke upon extraction. So the gum still had a lot of the roots, decayed roots in the gums. So the dentist actually had to work at it a bit longer to try to extract as much of it as possible. So when I was standing there looking at the dentist, really trying to extract as much as she can, and I see it from the patient's point of view, seems quite tough to be in that position as well, because I think the recovery after the procedure would be quite rough for him as well. So I did ask the dentist afterwards, and she was saying how it's much beneficial for him if all of the roots were removed, and further down the line, he would actually have a better recovery process.
Right.
So I think this opened my eyes to actually, in a more privileged position, we can actually reach out to these communities which do not have that privilege and support them in the ways that they couldn't. So I think coming back to Singapore, it gave me this opportunity to especially further my studies and gain some skill sets which I can use to impact this area of healthcare.
Yeah, we take so much for granted here.
Yes. Well, in fact, let's pick up on that point from Ms. Syazana. As you're saying, he saw that and he came back, and then he's building his skill set so that he can presumably go perhaps do this again, but do it a lot better because you yourself are that much better. Now, correct me if I'm wrong, it was 2015 when your mother was ill.
Yes.
You saw what happened when she got chemotherapy.
Yes.
And since then, you yourself, you studied social work, and you've also freelanced as a caregiver yourself. I take it whatever early impressions you had then about what you thought you might want to do and how you might want to do that, actually having to work and study, that might have changed what you originally thought. Has that done so? Have you fine-tuned what you really think you can contribute in your line?
I think my time studying as a social work student changed my perception in how I perceive these people who are receiving help in a way. I understand now that different individuals have different circumstances, and I've learned to become more compassionate over time, and to understand that they, in a way, they might not tell their full story to everyone, and everyone has a hidden story to tell. So I've learned to approach life with a bit more sensitivity and being kinder to everyone. Yeah.
You've both received these merit awards, and we want to congratulate you for that. But more than that, we want to know, having received these, having been the recipient, how is this going to spur you on further in terms of what you do? Jedidiah, perhaps you can begin.
Sure. So for me, what actually made the deciding factor for taking up the scholarship was actually two things. So firstly was I already know that I do want to enter into a hospital settings so that I can really fine-tune my skills in a more practical and a lot more exposure setting. Yeah. So this scholarship, it does come with a bond, but I think this bond was okay with me because it was in a sector that I didn't want to go into. The second one was actually in some of the engagements prior. Some prior scholars did tell us about how they do some community involvement projects, CIP, and as well as OCIP, which is overseas. So there was one particular scholar who was telling me about their project in Nepal, actually, before COVID. So I was able to relate with him, talk about common problems we see there, or common areas that they did visit. So I think that really sparked the interest. And I think through this scholarship, it also gave me a lot of opportunities to be involved in these projects as well.
Nur Syazana?
I think this scholarship really gives us the opportunity to build connections with current scholars and past scholars also. I think entering such a sector that can challenge us in certain ways, emotionally, physically, you really need that support system. And I think having this scholarship and the community within this scholarship allows us to meet like-minded people and make friends before we enter the sector. And when we do enter the sector, when we see these common faces, I hope in a way it will motivate us to push each other and continue to serve the patients.
Well, we thank you both for coming into the studio to share that with us. Thanks for joining us, and the very best on your journey ahead. That was Nur Syazana Gonzaga and Sebastian Jedidiah Jivon, recipients of the Healthcare Scholarship Awards.